Hello, my name is Dr. Robert Kaufmann, and we're about to go beyond the terminus. Have you ever had problems getting adequate anesthesia for your patients about to undergo endodontic treatment? This is not as uncommon as you think. Even with good anesthesia technique, sometimes patients simply aren't as well anesthetized as we would like when we use traditional infiltration or mandibular block methods of anesthesia, especially with mandibular molars. Supplemental methods of anesthesia must be used. In the case of the mandibular molar, we add a lingual injection or supplemental injection, and it was taught to me by Dr. Herbert Schilder of Boston University. It's also known as the Mylohyoid injection, and it frequently can deal with innervation on the lingual side of the mandibular molars. The syringe needle is introduced in the level of the attached gingiva, slightly above the mucogingival line. On the lingual side of the molar, slightly distal to the tooth that's being treated. Make sure to place the bevel of the needle in the direction of the bone. Only a small amount of anesthetic is necessary, just enough to raise a small blib in this area. This injection, combined with a well-placed mandibular block, is often sufficient to provide adequate anesthesia in the mandibular molar. In other areas, or what frequently is referred to as a hot tooth, I found that an additional injection into the periodontal ligament space on the four corners of the tooth provides enough anesthesia to allow us to access the pulp. Again, it's important that the needle be facing the correct direction. In this case, unlike the supplemental injection, since we're injecting into the PDL, we want the bevel facing outward, toward the bone, rather than toward the root surface. In essence, what you're doing is providing an intraosseous injection through the PDL space. At one time, I was using a dedicated device, such as a Ligament, to provide the pressure necessary for this injection. This has the advantage of being a little easier on the hand, since a lot of pressure needs to be exerted on the syringe to get the correct pressure to allow the anesthetic to be forced into the PDL. However, with more experience, I realized that really by applying the necessary pressure with a standard anesthetic syringe, I could basically achieve the same result. It's sometimes helpful to bend the 30-gauge short needle at approximately 45 degrees and use your opposite thumb or forefinger to guide the needle into the PDL space tightly. The needle must fit very, very tightly into the PDL space with no leakage. You want direct application of the solution into the periodontal ligament. Significant pressure has to be used to force the anesthetic solution into there, but only a small amount, a fraction of a carpule, is required for each corner. An alternative method is to use a totally separate device, such as a dedicated intraosseous system, such as the X-tip. I've used it, but I find that the PDL method is just as effective and far less cumbersome. I prefer not to use trephination on the buccal plates during anesthesia. There's also been some reports of sloughing of the papilla or post-op periodontal complications as a result of the use of this device, though I must admit they're rare. Should anesthesia still not be adequate for us to continue with treatment, a direct intrapulpal injection should then be attempted. It is the injection of last resort. You can find information on how to do this by checking my other Beyond the Terminus video that deals specifically with the intrapulpal injection. As with any case, should you find that your anesthesia is inadequate or you're simply unable to properly anesthetize your patient, consider referral. With proper technique, we have the ability to treat patients comfortably. There's no reason why patients should experience any discomfort during routine endodontic treatment. Remember, when we do the right thing, both of us get better, patients and clinicians. Thanks for joining me on this broadcast. Don't forget to subscribe. Tell your friends. I look forward to seeing you again the next time we go beyond the terminus. See you then.